Welcome to a comprehensive understanding of diabetes, mechanisms, prevention, and treatment strategies. Diabetes, particularly type 2 diabetes mellitus, or T2DM for short, is a global health concern that we can't ignore. It's a condition characterized by elevated blood sugar levels that, if left unchecked, can lead to serious health complications. But don't worry, it's not all doom and gloom. You see, the key to tackling this health issue lies in understanding the mechanisms underlying diabetes. By doing so, we can develop effective prevention methods and management strategies. So, whether you're a health enthusiast or simply someone who wants to know more about this prevalent condition, you're in the right place. We're about to embark on a journey to unravel the mysteries of diabetes, to empower ourselves with knowledge that can help us lead healthier lives. Now, let's dive deeper into the mechanisms of diabetes. Diabetes is complex and involves several metabolic processes. So, let's unpack these processes to better understand this perplexing disease. Firstly, let's talk about insulin resistance. This is primarily associated with type 2 diabetes mellitus. In a healthy body, insulin, a hormone produced by the pancreas, helps regulate blood sugar levels by signaling cells to take in glucose from the bloodstream. However, in the case of insulin resistance, the body's cells fail to respond effectively to insulin. This leads to glucose accumulating in the bloodstream rather than being used as energy. Then we have impaired insulin production. Over time, due to the constant demand to produce insulin, the pancreas may falter, leading to insufficient insulin production. This inability of the pancreas to keep up with the body's insulin needs results in an escalation of blood sugar levels. The third mechanism is beta cell dysfunction. The beta cells in the pancreas are the ones responsible for producing insulin. In the progression of type 2 diabetes, these beta cells can become dysfunctional. When this happens, the body's ability to control blood glucose levels deteriorates further. Understanding these mechanisms is like unlocking a puzzle. Each piece provides a clearer picture of how diabetes operates in the body. With this knowledge, we can develop targeted interventions to prevent and treat this disease. We can aim to enhance insulin sensitivity, protect the pancreas from overworking, and strive to maintain the functionality of beta cells. In essence, diabetes is like a domino effect. The resistance of cells to insulin sets off a chain of events, from the overworking of the pancreas to the dysfunction of beta cells. Each step contributes to the escalation of blood sugar levels, culminating in the onset of diabetes. But the good news is, understanding these mechanisms gives us a fighting chance against diabetes. We can use this knowledge to develop strategies that can disrupt this domino effect, potentially preventing or delaying the onset of the disease. Once we understand these mechanisms, we can focus on prevention methods. So let's delve into those in the next segment. Prevention is always better than cure. So, what are the classic prevention methods for diabetes? Let's dive into how we can shield ourselves against this prevalent health concern by discussing 4 classic methods: maintaining a healthy diet, engaging in regular physical activity, managing weight, and getting regular screenings. Firstly, our dining choices play a significant role in keeping blood sugar levels in check. A diet rich in nutrients, fiber, and whole foods, while low in processed and high-sugar foods, is the way to go. By keeping our plates colorful with fruits, vegetables, lean proteins, and whole grains, we can maintain stable blood sugar levels and reduce the risk of type 2 diabetes mellitus. Next, we have regular physical activity. Here's a fun fact. Physical exercise is like a natural insulin booster. It enhances insulin sensitivity, helping our body's cells respond better to insulin. Not just that, it also aids in weight management, which brings us to our third prevention method. Weight management is like a balancing act that has a significant impact on our health. Maintaining a healthy weight minimizes the strain on insulin-producing cells in our body, helping them function efficiently. This can prevent or delay the onset of type 2 diabetes mellitus, so whether it's through diet, exercise, or both, keeping our weight in check is crucial. Finally, we have regular screening. Early detection is our best defense against most health concerns, and diabetes is no exception. Monitoring blood sugar levels can facilitate timely interventions. It can help catch prediabetes, which is a condition where blood sugar levels are higher than normal, but not high enough to be classified as diabetes. With early detection, we can prevent the progression from prediabetes to full-blown diabetes. So there you have it. By maintaining a healthy diet, engaging in regular physical activity, managing our weight, and undergoing regular screenings, we can significantly reduce our risk of developing type 2 diabetes mellitus. In addition to these classic methods, lifestyle interventions can also play a significant role. Let's delve deeper into that in our next segment. Lifestyle interventions are effective in managing prediabetes and preventing type 2 diabetes mellitus. Lifestyle interventions are not a one-size-fits-all approach. They are uniquely tailored to individuals, taking into account personal health status, preferences, and goals. These interventions may be intensive, but they are effective. They include diet modification, increased physical activity, and behavior therapy. Diet modification is not about strict limitations, staying unrealistically thin, or depriving oneself of the foods one loves. Rather, it's about feeling great, having more energy, improving health, and stabilizing mood. It involves choosing a diverse range of wholesome and natural foods, reducing the intake of processed and high-sugar foods. Physical activity is another crucial component. It's not about running marathons or becoming a gym rat. It's about finding activities that you enjoy and that can fit into your lifestyle. This might be walking the dog, going for a swim, or even dancing around the living room. Regular physical activity can help to enhance insulin sensitivity, aid in weight management, and reduce the risk of developing type 2 diabetes mellitus. Now let's talk about behavior therapy. It's about making small, achievable changes that can have a big impact on health. This could be as simple as taking the stairs instead of the elevator, drinking water instead of sugary drinks, or getting a good night's sleep. But lifestyle interventions are not just about changes in diet, physical activity, and behavior. They also involve education and support. Knowledge is power, and understanding what diabetes is, how it affects the body, and how it can be managed is a fundamental part of lifestyle interventions. Support is equally important. Whether it's from healthcare professionals, family, friends, or support groups, having people who understand the challenges of managing prediabetes or diabetes can make all the difference. These support systems can provide encouragement, share experiences, and offer practical advice, empowering individuals to make informed health choices. When lifestyle interventions and preventive methods are not enough, medical treatments come into play. So, stay tuned as we delve into medical treatment strategies in our next segment. Medical treatment strategies are crucial for managing diabetes. This statement rings true for millions of individuals worldwide who live with this condition every day. When lifestyle changes aren't enough, or the disease has progressed significantly, medical treatments step in to manage blood sugar levels and improve metabolic control. Let's delve into some of these strategies. Pharmacotherapy, or medication, often becomes a necessary part of the diabetes management journey. Various types of drugs are available, each with its unique mode of action. For instance, metformin, one of the most commonly prescribed medications, works by reducing the amount of glucose your liver releases into your blood. It also makes your body's cells more responsive to insulin, thus helping to control blood sugar levels. Then there are sulfonylurias, drugs that stimulate the beta cells in your pancreas to release more insulin. Another class of medications, DPP-4 inhibitors and GLP-1 agonists, work somewhat differently. They prolong the action of incretin hormones like GLP-1, which stimulate insulin production in response to a meal. This helps keep blood sugar levels steady after eating. In some cases, especially in more advanced stages of diabetes, insulin therapy may be necessary. This involves injecting insulin into the body to replace or supplement the body's insufficient insulin production. But taking medication is only part of the story. Regular monitoring of blood sugar levels is another crucial strategy in managing diabetes. By keeping a close eye on these levels, individuals can make timely adjustments to their diet, exercise routine, or medication dosage. This continuous monitoring and adjustment of therapy based on blood sugar levels are like a tightrope walk, requiring balance and precision to maintain optimal glucose control. In certain cases where severe obesity accompanies type 2 diabetes, a more drastic intervention may be necessary: bariatric surgery. This surgical procedure reduces the size of the stomach or reroutes the small intestines, leading to significant weight loss. And the benefits don't stop at weight loss. Bariatric surgery can significantly improve metabolic control and, in some cases, even lead to diabetes remission. It's like hitting the reset button on your body's metabolic processes. So, from metformin to monitoring, from sulfonylurias to surgery, the landscape of medical treatment strategies for diabetes is vast and varied. Each strategy plays a unique role, and their combined forces can make a significant difference in managing this chronic condition. But let's not forget, while these medical treatments are invaluable in managing diabetes, they are but one piece of a larger puzzle. Lifestyle changes, regular exercise, a balanced diet, and regular checkups are equally important in the battle against diabetes. Understanding these strategies is key, but we must also remember that diabetes requires a comprehensive approach. So let's put all the pieces together, arm ourselves with knowledge, and march forward in our fight against diabetes. Diabetes is a multifaceted disease that requires a comprehensive approach. It's a complex interplay of disruptions in insulin production, insulin action, and beta cell function, which makes understanding the underlying mechanisms all the more crucial. Remember, prevention is always better than cure. Adopting classic preventive methods like maintaining a healthy diet, engaging in regular physical activity, managing weight, and regular screening can help manage and even prevent type 2 diabetes. Moreover, lifestyle interventions, including intensive changes like diet modification, increased physical activity, and behavior therapy, can be highly effective in managing prediabetes and preventing the onset of type 2 diabetes. Lastly, when necessary, medical treatments, whether it's pharmacotherapy, regular monitoring, or even bariatric surgery in severe cases, can play a vital role in diabetes management. With knowledge and proactive management, diabetes can be effectively managed and its impact minimized.